Millions of more Americans could soon be eligible for COVID-19 vaccines. The FDA is soon expected to authorize Pfizer's COVID-19 vaccine for adolescents ages 12 to 15. According to a federal health official, the decision could come early next week. Pfizer says the shot had 100% efficacy in adolescents as young as 12 years old and with similar side effects to what occurred in young adults. This comes as President Biden announces new goals for vaccinating Americans against the virus. At the White House today, he set a new target of having 160 million U.S. adults fully vaccinated and 70% of adults partially vaccinated by July 4th. CBS News' Skylar Henry reports on the president's new vaccination goals.
A federal health official tells CBS News the FDA plans to authorize the Pfizer vaccine for children aged 12 to 15 as early as next week.
I want American parents to know that if that announcement comes, we are ready to move immediately move to make about 20,000 pharmacy sites across the country ready to vaccinate those adolescents as soon as the FDA grants its okay.
Pfizer says clinical trials showed the vaccine was 100% effective in children that age and is well tolerated.
The antibody response is actually higher than the antibody response we've observed in adults, young adults. And also there were no positive cases in the study group with the data that I've been able to obtain.
Pfizer and Moderna are now running clinical trials for kids 6 months old and older.
At least 25 states have ordered less than their full allotment of vaccine doses because of lower demand for the shots. The White House told governors it will ramp up efforts to get more people vaccinated ahead of the 4th of July.
Our goal by July 4th is to have 70% of adult Americans with at least one shot and 160 million Americans fully vaccinated.
But the number of new coronavirus cases is dropping as well, prompting more states to lift all COVID restrictions.
I think folks that are saying that they need to be policing people at this point, if you're saying that, you really are saying you don't believe in the vaccines.
But health officials are still urging caution, as the variants of the virus are now spreading among unvaccinated young adults. Skylar Henry, CBS News, the White House.
Joining me now is Dr. Teresa Amato, the chair of emergency medicine at Long Island Jewish Forest Hills. Dr. Amato, welcome. Great to have you with us. What's your reaction to the president's announcement to administer at least one vaccine shot to 70% of the U.S. population by July 4th? Does that seem like an achievable goal?
So I think this president has set some lofty goals before. And we have met and succeeded those goals. So I'm all about trying to make sure, we set our goals pretty high because we really want to get as many vaccines into American arms as we possibly can. I do think it's a realistic goal. The amount of vaccine we have is not an issue anymore at all. We have plenty of vaccine to give to people. I think he mentioned a couple of things which we're seeing here in New York as well. Decreasing the age that patients or people can get vaccines, so going down to younger teenagers and down into 12 years old. That seems to be coming down the pike maybe in about a week, so that's kind of exciting. I do agree that we've had some of our older adults who have had a lot of trouble getting to these large vaccination sites, so really getting these vaccines into the community sites, our local churches, we're partnering with our pharmacy, so making it just very, very easy for anybody to come in and get a shot, including making walk-in appointments, which I think is vitally important, especially for older adults or people who may not have access to good Wi-Fi and internet. And finally, I think when we talk about hesitancy, I think that's going to be the really hard, the hard part of it, because there's so much that goes into vaccine hesitancy. And I think that as healthcare providers, we're really going to have to make it an individualistic type of program, because it's not just one size fits all when it comes to vaccine hesitancy. So really being mindful of people's cultural backgrounds, people's fear of just medicine in general, and really just answering people's questions, not being judgmental when people have hesitancy, but keeping an open mind and answering questions, sort of understanding their point of view and why they're nervous about it, and then trying to reassure or to make them more comfortable. What we have noticed is when people have hesitancy, they sometimes have a valid reason for having that concern. And so really, as a doctor, our job is to make sure that they understand why these vaccines are safe.
Now, as you mentioned, the president said he also wants to focus on getting the younger population vaccinated. The FDA is expected to approve Pfizer's vaccine for use in 12 to 15-year-olds soon. One, can this help us achieve herd immunity? And two, what do you know about this vaccine and adolescents?
So I have both professional and personal reasons for being interested in this vaccine for younger folks. I have 6 children, and so far just my youngest is not vaccinated because she is only 12 years old. I can just tell you personally, we had a situation where my son unfortunately got COVID and was around my cousin, who is was in the Army and had been served two tours a night in Afghanistan and had some lung issues. So when my son contracted COVID, he did quite well. He's a young 20-year-old. He did great. My cousin, unfortunately, ended up in the ICU out in California and was quite sick for a long time. Thank God did well. But I think when I think about families and their hesitancy, I think when it hasn't hit home and you haven't seen a young person and then someone who's at more risk get sick at one gathering, I think that's when you really start to understand that these vaccinations are very important, not just for our young folks, but to keep our folks that are at risk safe.
And what more can you tell us about the vaccination for young people, for the youngest people that it will soon be approved for, 12-year-olds, for instance? Is it the same dose that goes to an adult? Is it adjusted slightly?
So I think that's what they're really studying right now. What is the most safe and effective dose? It seems like the data is going to come out that for a child of 12 and older, probably the adult vaccine dose is probably going to be the dose that we're going to be giving this age range. I think when you go below 12, they're really going to have to start seeing whether or not we have to give a lower dose. But that will come out when the FDA shares the data that they've collected, and then we'll know what's a safe and effective dose. I do think it's still going to be the 2 doses of the Pfizer, the 2 doses of Moderna. I believe they're doing Pfizer right now for the 12 to 15-year-olds. I don't believe Moderna is coming out yet. But I think that's going to be an exciting time. Again, with our kids getting back to school, we're really hoping by the fall we get a lot of these kids vaccinated. So the teachers are safe and the kids are safe.
And will this help us reach herd immunity once we get sort of a large percentage of adolescents vaccinated as well?
So herd immunity is based on a couple of things. So one, it is the number of people that are fully vaccinated, and then the people that have gotten the immunity from actually catching COVID, who have antibodies that are, strong enough that they can fight any type of a second infection. So when you look at that, you're thinking somewhere around 70% of the country would either have to have the antibodies from the disease itself or the vaccine. If we don't start looking at our younger adults, our teenagers, and then down to children, we may not be able to get to that number. I am concerned that there are going to be some parents that will also have some hesitancy, and so we're going to have to be answering a lot of questions and reassuring people. But I think the key is to get all those older adults vaccinated, but also to start thinking about our younger adults and teenagers, just to help keep the rest of the country safe.
And finally, what about global vaccination efforts? We heard the president address the incredible problems India and Brazil are having getting their arms around the coronavirus. How important is it that we help other countries with those vaccination efforts, on one level in a simply selfish way so that those variants don't work their way back here? I mean, obviously we want to help those people for humanitarian reasons as well, but does this also raise the risk that, we can see a lot of those variants pop up again here in the U.S.?
So you make a great point. What we've seen time and time again is COVID is very discriminatory. It seems to target people at a lower socioeconomic class. It affects people of color. We've seen it, now in countries that have less resources. I mean, I look at the pictures from India and my heart absolutely breaks. It takes me right back to, a little bit over a year ago when we were the epicenter. And I remember those days of really wondering if we were going to run out of oxygen. And I was so incredibly blessed to work for an organization and be in a country where we were able to get oxygen for all of those patients. And I think to myself, if I was a doctor on those wards and the oxygen ran out and people died, how horrible I would feel. and how helpless I would feel. So I think it's incredibly important that we do give humanitarian relief. We're a melting pot here in America, and a lot of folks here have family that are back there and are really suffering. So yes, from the altruistic point of view, we should be helping out with vaccines and equipment. And for a global relief effort, you're right, we're not going to get this past us until we all work together. And we know when we work together, we get more resources, and we can hopefully beat this down much better and much quicker if we work all together as one global response.
Absolutely. Well, Dr. Teresa Amato, thank you so much for joining us. We appreciate it.
Thank you so much.